Hello and welcome to another Community Talk. I'm Derrick, Silas, your host, the City Communications Director. And with me today is Katrina Yokum, who's the PACT Outreach Coordinator and the Congressional Liaison. Katrina, welcome today.
Thank you. Thanks for having us.
All right. Well, first, Dan, give us a brief overview of your position and the mission of the Oklahoma Department of Veteran Affairs and the purpose of the Oklahoma VA healthcare system.
Yeah, so I'm a Congressional Liaison here at the Oklahoma City VA Medical Center here in Oklahoma City. I manage and coordinate all matters involving Congress and Senate. I share information with our congressional partners on areas of interest. I help their constituents when they're having maybe some medical needs or situations that are happening here. And then I'm a liaison between the VA and the congressional partners. But part of my job is to really foster good relationships with the community and with our community partners. So that's why I've kind of taken on this outreach role here at the Oklahoma City VA Medical Center. And then here at the VA Oklahoma City healthcare system, we offer a wide range of health and support services for our veterans, for our service members, and for even their families to just give them that opportunity to exercise their VA or their veteran rights. And we do that throughout the state.
Okay, very good, very good. So tell us about the PACT Act Resource Fair that's coming up in Enid.
Yeah, so the PACT Act Resource Fair that is happening in Enid, we're calling it a road trip because Enid is our first one, and it was really imperative to our director and to the leadership here to get out to the rural communities first, because that's usually where veterans in Oklahoma live. So Enid is our very first PACT Act Resource Fair. It's on February 23rd, 2023, from 3 in the afternoon to 7 p.m. at night. We're really, the whole point of the PACT Act Resource Fairs is that we're having trained toxic exposure screeners come to their on-site area to screen anyone who really comes to this event. It's really imperative that everyone gets that screening to not only ensure their health and benefits, but also to give us the ability to provide medical documentation for the future research that will come from these screenings. Along with those screenings, we decided, well, why just bring the screeners when we could just bring the whole bus? And so we really wanted to do a one-stop shop for everybody in that rural area. We thought we would bring eligibility enrollment for veterans who have not enrolled with us, or maybe they need to update addresses or whatnot. We also have the local Enid clinic coming on board so that veterans can come out and meet their local providers. We'll have schedulers there so that if, for example, they come out of that toxic exposure screening and they may need to have future appointments, follow-ups with that, we have schedulers going to be there so that we can make those appointments right then and there. They're walking out the door with that date and that time. But then we also are bringing on our counterparts. We're bringing Veterans Benefits Administration, often called VBA. They're there to file PACT Act service connections and then to help advise veterans on their PACT Act presumptive diseases. And then Oklahoma Department of Veteran Affairs will also be there to file for claims or service connection claims, and then also to enroll in the Oklahoma Veterans Registry. And then we also have various resources that are coming from our Oklahoma City main campus here, suicide prevention, job fair is happening, things like that, so that veterans can get just that one-stop shop feel.
Okay. So is this a free event, and who is eligible to attend this particular event?
Absolutely, it's a free event. All of our events will be free in the future. And then anyone who's ever served or has served, anyone who is serving or has served really needs to come to this event. I think a lot of people see PACT Act and they immediately think, oh, that's for the younger generation of Iraq and Afghanistan, but that's not true. If you really dig into what the PACT Act does, that opens up for anyone who's ever been exposed to toxic exposure. So I really encourage anyone of any generation to get out here, get screened, get seen, so that those things are in your medical records and that so your future, medical documentation can be followed.
Very good. For those who may not know much about the PACT Act, give us a brief overview of what that actually is and means.
Yeah, so we in the military, military person myself, we use a lot of acronyms, right? So we constantly talk about the PACT Act, but we don't really talk about what PACT Act really means. The PACT Act is really the promise to address Comprehensive Toxics Act of 2022. And that new law helped expand the VA healthcare and the benefits from the veterans exposed to burn pits, Agent Orange exposures, and then any other toxic substances. That law helps provide generations of service members, veterans, and even their families with care and benefits that they've earned and honestly they probably deserve. That PACT Act adds to the list of those health conditions that we assume or we're presumptively assuming have been caused by exposure to those substances.
Okay. Is there anything else that people should know? Well, I'll say, give us again the exact time, date, and location of the event.
It's going to be at the Enid VA Clinic on February 23rd from 3 to 7 p.m. The address to that clinic is 915 East Owen K. Garriott Road, Enid, Oklahoma.
Okay. Is there a particular website or a local phone number that you can share with individuals also?
Yes, so we run most of our website stuff off of our Oklahoma City VA Healthcare System Facebook page. You will find all the information there. And if you want to contact somebody about this, you can obviously always call me at 405-456-5605, or you can also get a hold of our public affairs officer, Carmen Daughtery, at 405-456-3055.
Okay. So how can people, and they can apply for health care eligibility? How can they do that?
Yeah, so I really encourage anyone who hasn't enrolled in the VA to really get in and enroll. With that, the PACT Act has really enlarged that availability because of some of the presumptives. A lot of times, veterans may have been either they make too much money, so they don't meet the means test, or they don't have a service connection. So those are two ways that sometimes veterans are ineligible for the VA. But with this PACT Act, that's really enlarged that. So I always tell veterans to come, bring your DD-214 so that we can look at that, look at your eligibility. Of course, we'll have eligibility and enrollment there so that we can discuss moving forward what that looks like with your health care.
Okay. Very good. You've given us very good information. I was looking at some other information. There were some other assumed service-connected conditions. Can you talk about some of those? And most people probably don't even know that it's part of it.
Yeah. So I'm a veteran myself. So I'm very passionate about ensuring that all veterans get the care that they deserve. I came from a rural area of Nebraska. I wasn't educated on it myself. And I'm constantly running into veterans in the rural areas and even in the city, really, that just don't understand how VA overall works. So you have the Veteran Health Administration. That's where you come to the VA to get, your doctor's appointments, your medications, your specialty care, right? That enrollment, of course, will be there. But then you have the Veteran Benefit Administration. And they're a whole other department. They have their own directors and they have their own process. And that service connection really is about if you were injured or you accrued an injury, whether that's mental or physical, while you were in the service, and you are now out, you can apply for a service connection due to the fact that that injury has accrued and it is affecting your life now. So it's really imperative, these presumptives that have come out because of the PACT Act. For instance, I went to Iraq in 2006, 2007. I was, part of Desert Storm. You have the Desert Storm, the wind, the sand. I was also around burn pit exposures. There are things that I could file for, cyanitis, rhinitis, those kind of things that the PACT Act has brought on, that I'm able to connect that service connection because while I was in Iraq, I had those issues. While I'm out of Iraq, it affects my life now. So that's what the PACT Act has given me.
Okay. Very good information. And I'll guess one more time before we end, one more time, tell them the date, the time, and the location of the event here in Enid.
Yeah, so we're having a PACT Act resource fair here in Enid VA Clinic. It will be on February 23rd from 3 to 7. I encourage every service member or veteran to please come out, get screened, and then also just meet us and meet our team.
Very
Then,
good.
furthermore, I'd like to also say, too, that we are counterclockwise-ing this. We will be going to Woodward on March 27th, same time, 3 to 7, and we'll be at High Plains Technology Center for that one.
Very good. I appreciate you for joining me today, Katrina. Thank you for all your information, and hope to see you. Hope that some of our veterans are there. Hope to see you there. So.
Thank you, Derrick.
Thank you.
Thank you.
Bye.